Hi, I'm Chris, laser tech and esthetician here at DTRN. Thank you so much for joining us here at the virtual event for Ultimate in Skin Rejuvenation. Today we'll be talking about BBL, Moxie, Halo, and Perfractional technologies. I want you to stay until the end because I'll be here to answer your live questions as well. And we also have 3 amazing giveaways. Those include a single Moxie treatment, an even and correct serum, as well as a $250 DTRN gift card. Winners will be notified by email. Additionally, we do have specials on laser services, and these will be on both single and package treatments. All right, so we're going to start off with talking about BBL. BBL does not stand for Brazilian butt lift, okay? BBL stands for broadband light technology. Broadband light is a form of photofacial, and photofacial helps with tone irregularities. So we can think of sun damage as well as rosacea, just general uneven tone. The additional thing that BBL does for your skin is it really helps with the overall skin quality. Moxie. Moxie is a gentle, non-ablative laser that helps with skin rejuvenation. It helps with skin irregularities, including fine lines, pores, as well as sun damage, and it's safe for all skin types. Halo. Let's talk about Halo. I love Halo so much. Halo is a dual wavelength laser, so that means one wavelength is ablative, the other is non-ablative. The non-ablative wavelength deeply heats tissue and can help with concerns such as acne scarring, fine lines, wrinkles, pores, and sun damage. And really these 2 technologies work together for the best outcome. This particular device, or service rather, is safe for all skin types as well. It may or may not be the first go-to depending on your concerns, but just know that we can treat a variety of skin types with this technology as well. All right, and last but not least, we're going to talk about Perfractional. Perfractional is a skin resurfacing treatment that creates microscopic channels in the skin to help with deeper irregularities, such as deeper lines, really deep acne scars, as well as tonal improvements. This particular treatment does require more downtime, and you're definitely going to be counseled on what to expect before and after a treatment like this. While all 4 of these technologies are absolutely great on their own, when we combine the technologies together, we can come up with even more amazing results. So BBL, Moxie, Halo, and Perfractional are combinable treatments. We call this stacks treatments. And when we do this, we're coming up with a personalized treatment plan for you to address your specific skin concerns and needs. Now let's review a few before and afters. So our first case, this patient did BBL treatment. We've actually only done 2 sessions on her in these before and after photos. And usually there's no downtime with BBL, or I would say minimal downtime. In this case, this patient did have some swelling and some mild bruising after her treatments, which can definitely happen with somebody who has a vascular condition like rosacea. That was resolved for her in just a couple days' time. For our next case, this patient did BBL and halo treatment. In her before and after, it actually was a year's time between those, and she only did one session. Typically, we do want to do 2 sessions if possible for the best outcome. Her downtime was around a week, and with halo, we can have a little bit of swelling. Sometimes we can have a lot of swelling. It just depends, but we do have ways to help mitigate that discomfort and help with your healing. So during your consultation, we'll definitely go over that. For our last client here, we also did BBL and halo, and this patient did a series of 2. She was actually getting ready for a wedding, and just a couple months after her second session, we noticed that her skin was already smoother, her pores were tighter and more fine. Again, about 7 days of healing or downtime, so to speak, on this particular case with BBL and halo. And we do also do body treatment. So if we get into that, it does take longer to heal on the body, somewhere around 10 days. Thank you, everybody, for attending the virtual event with us. Please be sure to stick around so that we can answer your questions at the end of the event. I'll be around for about 15 to 20 minutes to answer whatever questions I can for you. Additionally, don't forget that we have 3 amazing prizes, including a Moxie treatment and even a correct serum, as well as a $250 DermaTouch RN gift card. Winners will be notified by email. And last but not least, be sure to reply to your text message, yes, if you would like to schedule a consultation with us so that we can come up with your personalized treatment plan. I'm Chris, and this is Ashley, and we are here to answer your questions live. We will do our best to get through as many as we can, but if we don't get through them during this live session, we definitely will follow up and answer your questions for you. Just want to remind you, we have 3 great prizes for joining this virtual event here, and that includes a Moxie treatment, even a correct serum and a $250 DermaTouch gift card, and winners will be notified by email. So again, thanks for joining. Let's get to some questions here. So I have a question here. Is this treatment combination painful, and will I need any type of numbing or pain relief? It really depends on what combination we're talking about. Most of the treatments, when we do apply a topical numbing cream or do something to help mitigate the discomfort during the session, is pretty comfortable during the session. It depends on what treatment we do as to how you'll feel after. And this is actually why a consultation is really important, because we're able to go over the expectations of each individual treatment, and the treatments that are recommended for you really depend on what your concerns are. Ashley, I'm going to let you take this next question here.
Okay. So can I combine these treatments with injectables like Botox or dermal fillers? So you can definitely combine with Botox. Sometimes with treatments that can cause some swelling, they don't recommend doing fillers immediately post. But most of the lasers, Botox is completely fine to do right after treatment.
Perfect. Let's see what else we've got here. Are there specific aftercare questions? Second here. I'm sorry, are there specific aftercare requirements following the treatment combination? Again, this is a question that's really best answered during your consultation, because it depends on what treatment we do as to what your post-care is like. But a generalization when we get into lasers and light-based devices is we do usually have some time out of the sun at the very least. And then again, just depending on what we're doing depends on what you need to do after the treatment. So again, that's where a consultation is going to best answer this question for you. Next question, I'm gonna let Ashley take this one.
Okay. So what is recommended for hyperpigmentation, especially for above the lip? So with hyperpigmentation, there's different types. We have sun damage, we have melasma, we have post-inflammatory hyperpigmentation. So in this instance, that would be a great time to come in for a consultation. That way we can determine what type of pigment it is. For quite a few of the laser treatments, if you have melasma, you're not a candidate. We don't want to make it worse. Sun damage, absolutely. So if you're a little bit concerned, you're not too sure, schedule a consultation and we can work out all of the details for you.
And the good news is if lasers are not the best treatment for you, we have a variety of services here at DermaTouch, so we're sure to have something that can help with your concerns. All right, anything to do or avoid prior to the treatments? Again, this primarily depends on what treatment we're having, but some general rules of thumb would be to avoid tanning, direct prolonged sun exposure, or even using at-home tanners for usually 2 weeks before the treatment is best. And then typically with retinols or chemical exfoliants, again, kind of like that 3 to 7 day window is best, but I would say a good rule of thumb is 5 to 7 days. Other than that, it's really dependent on the treatment itself. All right, let's see what else we have here. How long do you need to wait between BBL treatments? So typically that's 4 to 6 weeks. It does depend on what area of the body we are treating, but the face is typically every 4 weeks and body areas are typically 6. What combination of treatments are good for the hands and the chest? Actually, all of these treatments can be done pretty well anywhere on the body. Probably not as much for a fractional. We're going to be a little bit more particular about where we would do that particular service, but we can do like a BBL and a halo, or BBL and Moxie, or maybe even BBL is what is needed. It just really, again, depends on what your concerns are. I'm going to take that one.
Which of the two, BBL or Moxie for sun damage? Hey, both of them. You can do BBL alone, you can do Moxie alone, you can do the combination. BBL is going to be a little bit more surface, so it's very much an instant gratification treatment. We love it for that. Moxie is really going to target that deeper sun damage. So think BBL surface, Moxie deeper. Ideally, if you're doing BBL, at some point you want to do Moxie or some other type of laser to target that deeper sun damage. If we don't target that, it's going to continue to make its way through to the surface, and then we'll be doing BBLs forever.
That said, you don't typically go back to where you started with BBL, but a lot of times what will happen is a patient will come in and they'll say, well, these spots reappeared, and that's at the point where we need to treat at the deeper dermal layers, and that's where Moxie or Halo or something like that can help with that. Next question is, can you do BBL and Moxie on the same day? Yes, we can. We can actually combine a lot of these treatments together. So again, this is where we're able to personalize a plan for you, and we do have a lot of patients that actually like to do stackable treatments. Okay. So have a question on 10-day downtime. That is not bad. What is the worst case scenario and how soon can you wear makeup? When we get into profractional, that's a little bit of a different question, and you definitely need to talk to your provider in order to find out the answer on that, because it really depends on what we're working on. But what I would say, 10-day downtime, that's a little on the more extreme side. For body areas, sometimes it can take a little bit longer to heal, but I would say 5 to 7 days is the typical downtime for healing on the face area. And again, it really depends on what we're starting with and what we're working with. Okay, good question. When you say downtime, what does that look like? Ashley, I'm going to let you take the floor on this one.
So downtime is going to be a little bit different for each treatment and even per person. We have some people that swell a lot, so that means their swelling could be anywhere between 3 to 5 days, depending on the treatment. You can have some redness. There's all kinds of different things that can kind of pop up with it.
When we get into, sorry, I just want to pop in here. When we get into the lasers like Moxie and Halo, we can have microcrusting as well. So that is a given, and I would definitely expect that. And it's usually going to be about 7 days until that's fully resolved on the face, and it can be a little bit longer on the body. Did you have anything else to add there?
was good.
All right, we are getting some questions about pricing. So we do have some laser season specials. They are posted online. I would recommend that you start there, but it does depend on what areas we are treating. So with the specials, again, you're probably going to start around 300 and go up from there, depending on the treatment and the areas. How long is it realistic to expectation to stay home from Halo, like not being fit for public consumption? Honestly, I feel like people look pretty good after they cleanse the morning of day 5. So a lot of my patients might make a long weekend out of it. They'll schedule the treatment for a Thursday and be back and ready for work on Monday. So that's very individual, but I would say that's a general case there. Let's see, what treatment is best for light to medium olive skin with melasma? Since Ashley already talked about melasma, I will let her continue on this one.
Yes. So with melasma, typically lasers are not recommended. We do have a couple that are somewhat safe for melasma, Moxie being one, and then Cool Peel being the other. Would we treat melasma with a laser? Probably not, but we do have some melasma safe options.
How many treatments average to treat pigmentation? That all depends on the severity of pigmentation. It depends on what particular device we're choosing. So if you're trying to go with maybe a more budget-friendly approach and say you start with a BBL treatment, typically you're looking at somewhere between 4 to 6 sessions for improvements with that. And it doesn't mean that you don't see improvements on the way. You actually see the most improvement with the first couple sessions, but we get to refine our work as we continue going through the sessions. Other treatments, it's typically going to be 2 treatments for the Halo, and Moxie can be up to 6 treatments, just depending on what our goals are with the treatment. All right. How long would I need to wait after brow lift to do treatments? We actually recommend that you get clearance from your surgeon before you continue treatments with us. All right. What is the cost of the initial consultation? We charge a $50 fee for our consultations, but we actually give that back to you when you treat within 30 days. So essentially it's free. And then we have a question about Botox. You want to answer that one?
So how long after getting Botox do you need to wait before getting one of these treatments? So ideally with any type of treatment, we say 2 weeks after Botox. It's just a safe practice that we've been doing. It might be a little bit different from practice to practice, but here we do 2 weeks.
All right, what's the best for hyperpigmentation around the cheeks that's not melasma? Again, it's best to have a consultation so we can really assess whether is it from acne scarring, is it from sun damage or other means, but typically Halo, Moxie, or Profractional can help with that, and possibly BBL as well. Got a question. Can these help with jowls? While none of these treatments are actually approved to help with lifting of the jowling area, I have treatments that are. You can get some tightening from these treatments, specifically Halo and possibly Profractional treatment, depending on the treatment that's done. But typically, a lot of people love doing Halo because you just get an overall skin rejuvenation. It gives you a nice refresh. How long do the procedures take, and is there a residual effect the following day? Well, it depends on the service that we're doing. The Moxie takes 8 to 10 minutes, so very quick. Whereas when we're doing a Halo, I'm typically on the face around 45 minutes to maybe an hour, depending on what I'm working on with the patient. And there are typically residual effects the following day, but again, it just depends on which particular treatment we are working with there. Let's see here, specifically for skin texture. Skin texture is really well addressed actually with the Moxie treatment. It depends, again, let me be a little bit more clear here. It depends on what the skin texture is, right? We could talk about acne scarring, could be skin texture, it could be enlarged pores, it could be fine lines. All of those really fall under textural concerns. Even wrinkles could be texture. So we really have to make an assessment to see which of the services is going to be best to address your particular texture concern. And let's see here. All right, so we do have some remaining questions, but we will get back to you guys that we didn't get to answer the questions. And just want to say thank you again for joining us for the virtual event. And just as a reminder, the winners of our giveaway will be contacted by email. So that's a $250 gift card, even a correct serum or a Moxie treatment. And then all right.
Thank you.
Bye.